Welcome to the Coronavirus COVID-19 Safety Training. In this training, you will learn about COVID-19 and identify steps that you can take to help prevent the spread of the virus. This course was developed by subject matter experts from across the organization and developed in consultation with the Cleveland Clinic. You'll learn today about what is COVID-19, control and prevention, mask use, hand washing, social distancing, disinfecting high-touch areas, pre-shift screenings, safety refresher for returning and furloughed associates, and we'll provide a few other resources as well. What is COVID-19? What is a pandemic? A pandemic is a global outbreak of a new or novel pathogen that is able to infect people easily and can spread from person to person in an efficient and sustained way. So how does a pandemic occur? A pandemic occurs when a pathogen or illness emerges for which people have little or no immunity and for which there is no vaccine. An example of this is the H1N1 influenza virus that occurred in 2009. The disease spreads easily from person to person and can cause serious illness. It can sweep across the country and even around the world in a very short time. The emergence of severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2, previously named 2019 novel coronavirus disease, in China at the end of 2019 has caused a large global outbreak and is a major public health issue. It is spread by human-to-human transmission via droplets and direct contact, and the infection has been estimated to have a mean incubation period of 6.4 days. The virus is not foodborne, and there is no current evidence that it can be transferred from person to person by consuming food or beverage. COVID-19 is thought to be spread mainly from person to person, primarily through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouth or noses of people who are nearby or possibly have inhaled into their lungs. Spread is more likely when people are in close contact with one another within about 6 feet. It may be possible that the person can get COVID-19 by touching a surface or an object that has the virus on it, and then touching their own mouth or nose, and possibly even their eyes. This is not thought to be the main way that the virus is spread, but we are still learning about this virus. The virus that causes COVID-19 is spreading very easily and sustainably between people. Information from ongoing COVID-19 pandemic suggests that this is spreading more efficiently than influenza, but not as efficiently as the measles, which is also highly contagious. Control and prevention. Measures for protecting workers from exposure to and infection with SARS-CoV-2, the virus that causes coronavirus disease 2019, depend on the type of work being performed and exposure risk, including potential for interaction with people with suspected or confirmed COVID-19 and contamination of the work environment. Compass Group has adapted infection control practices based on thorough OSHA hazard assessment using appropriate combinations of engineering and administrative controls, safe work practices, and personal protective equipment, PPE, to prevent workers' exposures. Here are some general guidelines for all associates and employers. Regardless of specific exposure risk, it is always good practice to frequently wash your hands with soap and water for at least 20 seconds. When soap and running water is unavailable, use an alcohol-based hand sanitizer of at least 60% alcohol. Always wash hands when they're visibly soiled. Stay home if you're sick. Avoid touching your eyes, nose, and mouth. Avoid close contact with people who are sick. Practice good respiratory etiquette, including covering coughs and sneezing. And recognize personal risk factors. According to the U.S. Centers for Disease Control and Prevention, or the CDC, certain people, including older adults and those with underlying conditions such as heart or lung disease and diabetes, are at higher risk for developing more serious complications from COVID-19. So let's talk about hand washing. Proper hand washing is the most effective method of preventing disease transmission. Therefore, it is imperative that associates wash their hands properly and keep exposed portions of their arms clean. Food being prepared can be contaminated by food handlers with soiled hands or fingernails. Proper hand washing is necessary to ensure that soil and pathogens that may be present are effectively removed from the associate's hands and arms, and to minimize the likelihood that your hands are becoming a vehicle of cross-contamination. In addition, associates must clean their hands strictly in hand-washing sinks to avoid contamination of food preparation sinks. Here are proper hand-washing procedures. Associates must use the following cleaning procedure in order stated to clean their hands and exposed portions of their arms. 1. Rinse hands and arms under clean, running, warm water. 2. Apply an amount of soap recommended by the hand soap manufacturer. 3. Rub hands together vigorously for at least 20 seconds while paying particular attention to removing soil from underneath your fingernails during the cleaning procedure and creating friction on the surfaces of the hands, arms, fingertips, and area in between your fingers. 4. Thoroughly rinse hands and arms under clean, running, warm water. 5. Immediately follow the cleaning procedure with a thorough drying method, such as disposable paper towels. 6. To avoid recontamination, associates may use disposable paper towels when touching surfaces, such as manually operated faucets and hand washing sinks or the handle of the restroom door. So when should you wash your hands? Associates must wash their hands in all of the situations listed below. Immediately before engaging in food preparation, including working with exposed food, clean equipment, utensils, and unwrapped single-service use articles. After using the restroom. Upon entering and returning to the kitchen or other food handling areas. When switching between working with raw food and working with ready-to-eat food. After handling soiled equipment or utensils. After engaging in other activities that contaminate hands. When changing gloves, during food preparation as often as necessary to remove soil and contamination and to prevent cross-contamination when changing tasks, after touching your body, after coughing, sneezing, using a handkerchief or disposable tissue, smoking or using tobacco products, eating or drinking. In addition to food code requirements for hand washing, all associates must wash their hands at the following times to prevent potential spread of virus particles that cause COVID-19. After using a thermometer to measure the body temperature, before putting on a face mask, after putting on a face mask, and after touching a face mask, such as to adjust it for better fit, after cleaning customer service and seating areas, after removing any personal protective equipment such as face shields or goggles, after disinfecting highly touched surfaces and removing gloves used during disinfection of highly touched surfaces, after refilling hand sanitizer stations in the customer service areas, upon re-entering the kitchen or food preparation area, and before beginning your next task. Where should you wash your hands? Associates must clean their hands in a hand washing sink. Hands may not be cleaned in a sink that's used for food preparation, ware washing, or in a service sink or curbed cleaning facility used for disposal of mop water and similar liquid. Now we're going to do a knowledge check. Please answer true or false to the following 5 questions. Question number 1. Coronavirus is spread from person to person via droplets or direct contact. True or false? That's right, the answer is true. Question number 2. Staying home if you're sick helps reduce the spread of coronavirus. True or false? Awesome job, the answer is true. Question number 3. Covering coughs and sneezes helps reduce the spread of the coronavirus. True or false? Awesome job, the answer is true. Question number 4. Proper hand washing helps reduce the spread of the coronavirus. True or false? Again, excellent job. The answer is true. Question number 5. Wearing gloves is a safe substitute for washing your hands. True or false? Awesome job. The answer is false. Social distancing or physical distancing is all about avoiding unnecessary physical closeness with others whenever possible. It is important because, according to the CDC, COVID-19 is thought to be spread in 2 main ways. Between people who are within 6 feet of each other, and by droplets produced by coughs and sneezes. While the virus may be able to live on surfaces, the evidence is clear: if you stay 6 feet away from people as much as possible, you are less likely to become infected. The big problem is anybody could be sick but not know it yet. That is why everyone should practice social or physical distancing even if they feel they are fine. If others are reluctant to follow these rules, remind them it is not just about your own health, but the health of the people you may pass the virus on to. Everybody and every business has a part to play in slowing down the spread as much as possible. Social distancing in the workplace and what you need to know. There are steps that can be taken to effectively prevent the spread of COVID-19 in the workplace. Whenever possible, associates should stay 6 feet away from each other. Try rearranging workstations to make use of all the space you have available. This may seem obvious, but eliminate physical greetings. No hugs, handshakes, etc. It can be tough to get rid of old habits. Be sure to acknowledge other people, but just say hello or wave. Think about the places where associates and their guests are often close together. Either close these off or limit the number of people allowed in these spaces at the same time. Follow signs and other visual indicators in the front of house and back of house. Mask use. Mask use for food service associates is key. When wearing a mask in a food service operation, remember you must always follow the food code requirements for washing hands. Mask protocol is already in place for each healthcare unit. We follow hospital and client protocol. Pay special attention and avoid touching the mask while handling food. Touching or adjusting the mask should be considered the same as touching your nose or mouth, and hands should be washed before handling food or your next task. The following video will give you some safety hints on how to put on and take off a mask properly. Guidelines for wearing a surgical mask. Before putting on the mask, clean and wash your hands with soap and water. Inspect the mask for any tears or holes. Locate the metal strip in the mask. This is the top of the mask. Place the top part on the bridge of your nose, molding the metal strip to the shape of your nose. Cover your mouth and nose with the mask and make sure that there are no gaps in between your face and the mask. Replace the mask with a new one as soon as it's damp or soiled. Avoid touching the mask while using it. If you do, please wash your hands. Masks must be changed in between meal periods or every 4 hours as necessary. Do not wear your mask the entire shift or to the bathroom. To remove the mask, use the loops, discard of the mask, and then immediately follow by cleaning and washing your hands. Do not store masks in your pockets, and remember to be safe. We will now go over the pre-shift health screening. A culture of care and safety is paramount in everything that we do. As a result of the current pandemic, and until further notice, a daily pre-shift health screening is now required for all associates at all Compass Group locations in the U.S. In this section, associates will learn what is involved with health screenings, and managers will find guidance on how to appropriately screen associates for symptoms related to COVID-19 upon arrival to work. Health screening requirements will be based on the most stringent of our community, customer, and Compass Group framework. The health screening and temperature check represents Compass Group standards recommendations. However, sectors should follow their own protocols in place if already established. If a sector does not have a protocol, this section can be used as guidance. We also must follow federal and state guidelines in addition to sector protocols. The community should follow your local health department requirements. Your health department is aware of local aspects of the pandemic that may supersede those of your customer or client or Compass Group. As a customer, if the local health department does not have specific community requirements, understand your client's policy around daily health screenings and how it applies to our business. For Compass Group locations that are required to complete a daily temperature check as part of the daily COVID-19 associate health screening process, please follow your client's protocol. If your client does not have procedures in place, please utilize the Compass COVID-19 associate health screening process. For the daily pre-shift screening, all associates, hourly, and management are required to complete a daily temperature check as part of the daily COVID-19 associate screening process. Although having a fever does not mean an associate has contracted COVID-19, it does indicate that they may be unwell and should not be at work. Per the guidelines from the CDC, anyone who is feeling sick is asked to please refrain from coming into work. Temperatures are to be checked in a consistent manner for all associates within a given unit. Follow manufacturer's instructions for proper use of non-contact infrared thermometers for taking forehead temperatures. Temperatures should be taken in a private location as best as possible. Recording of temperatures should be avoided, unless required by local authorities, and any recorded temperatures must be kept in a confidential file, separate from personnel folders. Temperature checks can be completed on site by associate or manager. Here are the requirements. Once the associate or manager is verified not to have a fever, they may clock in for their scheduled shift. If the first temperature is above 100.3, repeat the scan. Any associates with a second temperature reading above 100.3 will be denied access. Associates will be denied into the building if they refuse screening. In addition to monitoring for a fever, managers must also be alert to recognize any symptoms of COVID-19, including but not limited to fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or diarrhea, vomiting. Immediately consult and follow the Compass decision tree for unit managers in the event that anyone is confirmed to have a temperature of 100.3 or higher, or appears to have any of the COVID-19 related symptoms. Follow these steps when taking temperatures. Number 1, an associate must put on gloves before handling a disinfected thermometer. Number 2, hold the infrared thermometer approximately 1 inch from your forehead. Depress the read button. Number 3, if the first temperature reading is above 100.3, repeat the scan. Number 4, entry will be denied to any associate whose second temperature reading is above 100.3. If the second temperature reading is below 100.3, the associate will be allowed to enter. Number 5, read the display and either place the thermometer back where you got it from or hand it back to the person who provided it to you. Number 6, once you have completed the process, disinfect the thermometer. Make sure to put on gloves before disinfecting. Disinfecting can be done with alcohol wipes, non-chlorine disinfectant wipes, any Diversey disinfectant product, or other disinfectant meeting the EPA emerging pathogen standard. Let's talk about the importance of disinfecting high-touch surfaces. CDC reports that the coronavirus that causes COVID-19 mainly spreads from person to person. When someone who is infected coughs or sneezes, they send droplets containing the virus into the air, which an otherwise healthy person may breathe in. However, because the virus can live up to 5 days on certain surfaces, it is possible to be infected after touching the surface or object that had the virus on it and then touching your mouth, eyes, or nose. For this reason, Compass Group has developed procedures on disinfection of high-touch surfaces. This would include, but not limit, light switches, doorknobs, telephones, handrails, wall-mounted soap dispensers, card readers, appliance handles, etc. Using either an EPA-approved disinfectant spray, meeting the emerging viral pathogen guidelines, or ready-to-use wipes in cafeteria operations. Ask your manager for a detailed list of procedures specific to the application process being used at your location. Let's do another knowledge check. Question number 1. You should wash your hands before putting on your mask. True or false? That's correct. True. Question number 2. You should not wash your hands if you touch or adjust your mask when wearing it. True or false? Correct. The answer is false. If you touch your mask while it's on your face, it is equivalent to touching your nose or your mouth. Question number 3. Is it okay to store your mask in your pocket? Yes or no? Exactly. The answer is no. Question number 4. Having a fever above 100.3 is an indicator of potential illness. Yes or no? That's right again. Yes. Question number 5. Disinfectant of high-touch surfaces help reduce the spread of coronavirus. Yes or no? Excellent job. You've been listening well. The answer is yes. All associates returning to work from furlough must review the information contained in the following 3 trainings that I'll tell you about. Number 1, DASSO training, or Dining Associate Workplace Safety Orientation. This course provides Compass Group Dining Associates an overview of Compass Group Safety Program. Number 2, Hazard Communication, an Associate's Right to Understand 2.0, or HAZCOM. This course acquaints learners with the precautions that both associates and their employers must take in order to safely use, handle, and store hazardous chemicals in the workplace. Number 3, Bloodborne Pathogen Awareness 2.0. This course provides associates with a basic understanding of bloodborne pathogens, common modes of transmission, methods of prevention, and what to do if an exposure occurs. Information presented will help minimize serious health risks to persons who may have personal exposure to blood and or other potentially infectious materials. If you're not sure that you've completed these trainings already, please contact your manager and they will assist you in finding out. There are plenty of resources for associates in case you find yourself in need. There are trainings in MyLMS, and you can always follow the CDC website for up-to-date information on COVID-19. We also have a Health Advocate Employee Assistance Program. So if you're looking for resources for your emotional health, visit Health Advocate, an emotional support hotline available to all associates. It's free, confidential, and available 24/7 to Compass Group associates and their families. Call the number listed on the screen for confidential access to a counselor. Congratulations! You've completed the coronavirus training. You will now have to complete a 10-question quiz and need a passing score of 80% to move on. Good luck.